Hello, my name is Rosetta Degbe. I will be presenting the Stakeholders Education Plan for Bradman University DNP 706. My project is Diabetic Self-Management Education Improvement among the Hispanic male first generation between the age of 18 to 64 years old. Location of this project will be the primary care clinic setting. The purpose of this project is to improve knowledge, skills, ability to perform self-care and alter lifestyle behavior in order to self-manage diabetes more effectively. Diabetes is among the most prevalent chronic disease in the United States. The prevalence rate of type 2 diabetes is 7.6 among non-Hispanic age 20 and older. The rate among Hispanic population aged 18 to 74 years is 16.9%, exceeding that of non-Hispanic blacks of 13.2%. Another study shows that diabetic self-management intervention combined with education during provider visit for Hispanic with type 2 diabetes have significantly decreased A1C. Lack of access to DSME has been a potential barrier to reach people with diabetes, especially in the communities. Description of stakeholders will be healthcare professionals, primary care physicians, DNP students or nurse practitioner, diabetes nurse educator, IT, pharmacy, primary care physician who focus on the person as a whole, who is responsible for referring patient to the DSME for additional support and self-management education. The PCP will also be the leader of the interdisciplinary team. The NP student will be working in collaboration with other care providers to ensure reliable blood glucose test results, developing and implementing written protocols orders set to address the treatment of both hypo and hyperglycemia. The plan will be involving the patient and family in care and decision making whenever possible, addressing patient comfort, concern, and areas of struggling. Diabetes educators play a vital role in the implementation process by identifying barriers and coordinate care to facilitate a smooth transition process, and will also support PCP efforts to intensify therapy and initiate insulin when appropriate. IT monitor patient registry and provide ongoing clinical updates to leadership and clinical staff. IT will be assisting patients in application of apps for glucose monitoring. Pharmacy assists in development of medication formularies and secure affordable medication options, work in collaboration with the nurse practitioner and PCP to titrate patient medication, provide input in the development and revision of the medication management section of the DSME protocols. Dietitians, as we know, will be assisting patients to achieve and maintain their healthy eating and health behavior modification goals. Also, dietitians will be educating about eating well and preparing healthy snacks, meals, and give general information on education as needed. Stakeholders education intervention will be utilizing the client education model. The role of client education can directly affect the client's health on adaptation to chronic illness and recovery. It is a process of influencing behavior and teaching the client self-care technique so that he or she can assume responsibility for certain aspects of healthcare. Education intervention is important in order to engage my stakeholders because stakeholders play the most vital role in the outcome of my project, and they are the primary recipient of my intervention. And as a result of that, stakeholders will fully understand their role, different interests, commitment, goals, and expectations. I will utilize the client education model to provide a framework for my education intervention. And as a DNP student, I'll be utilizing my skills and knowledge to engage and empower my stakeholders. And as a DNP, I will be also utilizing the nursing teaching, learning process, clinical judgment, nursing client relationship, an evidence-based nursing practice in implementing my education project in order to achieve my goals. I will be using the following method to educate and engage the stakeholders. Stakeholders will be engaged in the planning process. This will help the participant to build ownership of the project. I will be conducting interviews, questionnaire related to the topics in order to get ideas, feedbacks to determine the interest of the project. Collaboration and communication will be flowing for constant reinforcement, sharing ideas and giving feedback on how ideas are being incorporated into the process. And this will also allow patients to have an active and anticipatory role throughout the treatment process and teach them ways to practice risk-reducing behavior that promote a healthier lifestyle. Some of the learning objectives for stakeholders. Stakeholders will raise diabetes awareness among the Hispanic population and embrace the project to reduce diabetes complication and improve outcome. Stakeholders will recognize the prevalence and comorbidity related to diabetes among the Hispanic population and the need for lifestyle change intervention. Stakeholders will recognize the cost and benefit of evidence-based practice on DSME. They will recognize the need for the DSME project. My implementation plan will be in 3 phases. Phase 1, introduction and description of the role of the DNP student and other interdisciplinary teams. Participants will complete assessment tools, pre-interventions that include healthcare behavior, knowledge, and health history. Focus group education in the first meeting will include pathophysiology of diabetes information and diet, exercise, weight management, and food choice on the topic. Group activities will be held for patients to identify food groups such as carbohydrate, proteins, fruits, and vegetables. Group education will have focus on the explanation of the different types of diabetes medication, use of blood glucose meters, insulin preparation, injection techniques, knowledge, and possible barriers. Group discussion will also include patient skills in self-management blood glucose knowledge and managing hyperglycemia and hypoglycemia. In phase 2, weekly staff meetings for an update and to provide feedback on measures and outcomes from the evidence-based practice teams. The team reduced meeting frequency to bi-weekly. Participants will complete assessment tools post-interventions. In phase 3, post-interventions will be assessed on knowledge, skills of DSME, patient perception of self-efficacy, attitude, behavior, barriers towards diabetes self-management. Encourage participants to share personal diabetes-related experiences, thoughts, feelings in response to the topic. Response to input, feedback, and advice, and then makes the adjustment. A questionnaire related to the topic will generate ideas, feedbacks to determine the interest to the project sustainability. Encourage participants to provide constructive feedback regarding the topics, communications, and facilitation skills. Here are my references. Thank you for listening to my topics. Thank you.